afternoon. Thanks for sitting here after lunch. I'm Valerie Mojeka, and I work for MAPS, and I want to tell you about a study that I'm doing looking at outcomes of people who are treated with Ibogaine for substance addiction. First, I'll explain what Ibogaine is, since it's a pretty rare substance. It comes from a West African shrub called Ibogaine. She's over here. And the root is where the Ibogaine comes from. And tribal people in West Africa grind up the root and use it in initiation ceremonies as a rite of passage into adulthood. And here's a traditional Witi shaman here who would use the Ibogaine.
Lights? Close the lights.
Bill? Can you hear me okay?
Yeah.
And this is
Can we keep one light on the stage?
Yeah, we need a medium just for the camera.
Can you go back to the first picture with this slide?
They're all together?
I don't know.
Second one.
That one? Okay. So the man on the left is the shaman who administers the Ibogaine, and the woman is a family member of his. It's a nice picture, take a good one.
The light is here. The light is somewhere there.
Is that all right, Rod?
It's questionable. I'd say we should get at least half light if we can. That'd be great.
Okay. Can you turn it on? Yeah.
So Iboga was used many years in this way in West Africa. The ground up root was. This is a person going through an initiation with the shaman. And the guy that's painted in the back is the guy that's taking Iboga, and the guy in the front is the man that was in the last picture. And Ibogaine was brought to America, Europe, the Western world by a man named Howard Lotson. He discovered Ibogaine's anti-addictive properties. When he was 19 years old, he was in a group of people who were using drugs experimentally, and they came across Ibogaine. And some of the members of the group were at the time addicted to heroin, and they found when they came off of their Ibogaine trip that they weren't having the withdrawal symptoms that they normally would have. So he spent like 17 years and $1 million trying to get Ibogaine developed into prescription medicine. He helps us out now and is still involved trying to look into the effects of Ibogaine's property of its anti-addictive, getting rid of withdrawal symptoms from heroin and other opiates, as well as other drugs, both physical and psychological. So what Ibogaine does, Ibogaine is a psychedelic drug, but the effects that it has is more like producing a lucid dream. It's the person who takes it lies down, because if you move around very much, you get very dizzy and nauseous. It's a very internal experience, and you really don't want very much distraction. It's mostly you want to lay down with your eyes closed and really concentrate to have the experience. Many people report reviewing their memories on Ibogaine. Some people even say that it's like watching a movie of your life going by, where you can fast forward and pause and rewind. When I did it, the experience was more like I would see the memories how they were grouped in my head, but I did definitely see all those memories. The experience lasts several days, and with the acute effects being about 8 to 12 hours. But person generally stays in the clinic for a few days. Sometimes they sleep for a couple of days, or they're at least like dizzy and weak and not wanting to walk around. It doesn't have much potential as a recreational drug because it's not really fun. I've only met 2 people ever who enjoyed being on Ibogaine out of like hundreds of people that I've talked to. Although pretty much everyone I've talked to who has done it is grateful for their experience or what they learned, however unpleasant it may have been. When people take Ibogaine with the intent of getting rid of an addiction, oftentimes they'll experience material related to the addiction during their trip. Some people report seeing the events in their life leading up to their addiction, or maybe seeing what their life would be like without the addiction. And the main really amazing thing about Ibogaine that separates it from other psychedelic treatments for addiction is that it greatly reduces the physical and the psychological withdrawal symptoms from opiates, as well as from other drugs. So, of course, Ibogaine has some neurological activities, which I'm not really able to explain to you, but I did include this picture of the molecule for those of you who are able to read it. I can say that the mechanism of action is novel, it's different than any other pharmacotherapeutic treatment for addiction. It has complex interactions between multiple receptor sites. I've listed out some of the possible actions that it has based on research with animals, but it's very complex, and it isn't really sure exactly how Ibogaine works at getting rid of addiction, but it's definitely a very complicated process that I'm not able to explain to you right now. So, where do addicts normally take Ibogaine? Lots of people are seeking out this treatment, and unfortunately, most people who take it end up taking it in a hotel room, often with someone who's not really prepared to administer this drug. I'm sure there's some exceptions, but a lot of times it's not. The person will meet them in the hotel room, drop off the Ibogaine, and leave them there, hopefully stay with them, maybe not sometimes. Or, in the addict's home. These are real pictures of addicts' homes, by the way. But then there are other options. There are several clinics operating that are striving for a medical and therapeutic approach. They're striving to operate with better practices. And the Iboga Therapy House in Canada is where I'm going to be collecting data for the Ibogaine outcome study. It's currently closed, but they treated 31 patients over the course of about a year and a half. They treated people for free because they were receiving private funding from a person who sold marijuana seeds over the internet. And he eventually ran out of money and closed the clinic down. So the last year we've been spending trying to find out how to open the clinic again, get funding, and improve the services. I don't work at this clinic, but since I'm researching with them, I try to help them out and provide feedback whenever possible. They conduct treatments based on the treatment manual that Howard and Boaz and other people wrote. And we just applied for a grant to Health Canada in March to get funding from the government. The Canadian government, many people in the Canadian health system are supportive of the Iboga Therapy House. They want to see it running, and it's looking hopeful that we'll get the grant, and we'll find out this summer. If we don't get the grant, hopefully they'll be able to open up the clinic and have people pay for treatments. But Canada is a really good place for this to start. Their drug policy is based on harm reduction and health promotion. It's in Vancouver. They have North America's first safe injection site. North America's first heroin prescription trials are going to be starting this year, so it's really looking like a good place for Ibogaine therapy to become a legitimate treatment option. And also, because of the way the healthcare system works there, hopefully, if the treatments get started, they'll be able to link up with aftercare programs to get people into, because Ibogaine is, what they offer is more of a detox, and the main problem with most people taking Ibogaine is they don't have any aftercare program to go into. So of course they go back home, their dealer shows up at their door, and then go back to where they were before they took Ibogaine. And hopefully in Canada we can solve this problem by linking up with the appropriate rehab centers. I can't read that on this computer. But there's just a little flowchart they made about how people get Ibogaine treatments. There's the tribal, you can go to Africa, do it with the Bwiti. There's also a few people who offer Bwiti-inspired ceremonies who were initiated and then go back to North America or Europe and offer that kind of treatment. There's the purely underground treatments that are done usually in hotels or at home. They're questionably safe because a lot of times the person administering it doesn't have medical training. And I also want to mention here that the thing about Ibogaine that differs it from other psychedelics is it has potential to kill you. I'm sure that there are potential like that with other psychedelics, but Ibogaine has, for people who have pre-existing medical conditions from either a lifetime of drug abuse or genetic history, if they have heart problems, Ibogaine can make that worse, and there have been people that have died from heart problems on Ibogaine or from using another drug while they were on Ibogaine, which is why it's really important that these treatments are done in a clinical setting with doctors and proper therapists. So then we move on to the other place where the Iboga Therapy House falls into, the medical and therapeutic clinics. The Iboga Therapy House is one. There's several others operating right now. Deborah Mash has one in St. Kitts. It's probably the safest and most medical option that I know of, although the treatments are very expensive. And I haven't actually visited the facility. They even they go so far as to hook up an IV and an EKG to everyone who gets the treatment in case there's an emergency to deal with right away to adjust the blood pressure or heart rate. So these treatment facilities are already existing, providing this detox service. Iboga Therapy House will hopefully be running again soon, but they're not collecting any information about the treatments, and that's where I come in. We need to find out, there's lots of information about the short-term outcomes of how well Ibogaine works. It definitely works at reducing the withdrawal symptoms based on studies with humans and animals, but there's no really long-term information on how well it works in humans. There's very little anyway. So I just want to answer some basic questions with this study. How well does Ibogaine work? Who does it work for? What percentage of people benefit and to what degree? How can these treatments be improved? And should more formal studies be conducted of Ibogaine therapy? So my role will be, answering these questions, both evaluating their program and providing feedback to them, as well as collecting this information for a research study. I have some very preliminary data here that is from the Iboga Therapy House. 20 people who were treated there in a row. There were 11 people treated before that, but they're not included in this. This survey was done in June 2004, and the people that were surveyed had been treated between 2 weeks and 1 year before the survey was done. So it's an average of 6 months since most people's treatment. There were 20 people. 6 out of 7 who were treated for cocaine or crack reported that they were abstinent at the time of the survey. 3 out of 8 who were treated for opiates reported that they were abstinent, and 4 out of 5 treated for other substances like alcohol, methamphetamine, pot, or a combination of substances reported that they were abstinent. The thing to keep in mind with this data is it's very basic and preliminary, it's not controlled, and it suffers from a potential selection bias because the people that the Ibogaine Therapy House were accepting for treatment at that time were screened very rigorously to make sure that they would do well in recovery. They would only accept people who they thought were really ready to get off of drugs. Yeah, just keep that in mind. But it's still promising information and makes me want to go ahead with the study. So this is an exploratory outcome study seeking to obtain basic preliminary data. There's only 20 people. It's not a controlled study, but it is a representative sample since these are 20 people who are treated consecutively for drug addiction at the Ibogaine Therapy House. And there's going to be, of these people, we're going to survey them for a year, once before the treatment, once after the treatment, once 1 week after they leave, once 2 weeks after they leave, and then monthly for a year, to get a bunch of data points for that 1 year period of time. And all of these interviews are going to be verified by interviews with a significant other to the patient. That can be a therapist, a family member, a spouse, a friend, to verify the information and see if it's consistent. And in doing the study, I'm keeping a harm reduction model in mind, looking at abstinence as well as non-abstinence, and looking at changes in lifestyle, not just whether they're using or not, but how much they're using, what the route of administration is, and how frequently they're using.